Okay, Christy, you're giving your first dose of chemo today to Mr. Jason Jones. So there's some things that we got to go over. You already did your assessment. You already reviewed the NCI grading toxicity. The patient has no toxicities. This is his first treatment, so most likely he would not have any toxicities. So we're good for that. Okay, so now what we want to do is we want to review the orders. We want to review the consent. We want to do the drug calculations. Okay, so the first thing we're going to look at is there a consent? And there are 2 pages to our consent forms. Patient's name, the date of treatment, his date of birth, his medical record number, and the drugs he's going to be receiving. All of the side effects, patient signature, witness signature, and Dr. Lister's signature. So the consent is good. We just got to make sure that the drugs that are on the consent are the drugs that are on the order sheet.
Okay.
So you see Cytoxin, Vincristin, and Adriamycin, which are doxorubicin and cyclophosphamide. Okay. All right. So the next thing you want to do is we want to review the orders. How do we know that this patient with lymphoma is getting the correct treatment? There's lots of treatments out there for lymphoma, but we want to make sure that he's getting the correct regimen. Where would you look to find out if this is the correct regimen?
You could look on chemoregimen.com online.
Okay. And I copied you. I took this off of Chemoregimen so that you would know what the doses are for each drug that you're given and when you do your calculations. Okay? The next thing we want to look at is are the orders on here complete? And it does say cyclophosphamide. And what's the dose on there?
750 milligrams per meter squared.
The next one is?
Doxorubicin or Adriamycin, which is 50 milligrams per meter square.
Okay.
Vincristin, 1.4 milligrams per meter square, with a maximum of 2 milligrams per dose.
Okay.
And prednisone, 100 milligrams PO every day, day 1 through 5.
Okay. All right. So we know that that is the correct regimen that they want to give this patient. So the next thing we want to do is check the lab values, make sure that all the lab values are within normal limits, and they wanted us to notify if the ANC is less than 1500 and if this creatinine is less or greater than 1.8. I see our creatinine is 0.8. Looks like our potassium is a little low. We'll have to call and get some potassium replacement for that, but that won't stop us from giving the chemo. We want to look at the platelet count. It's greater than 100,000. So what you need to do now is calculate the absolute neutrophil count. Do you remember how to do that from your class?
Yes, it is the number of neutrophils, which for him is 74%. So 0.74, you would add bands if there were any. This patient does not have any bands. So you would take your neutrophils, which is 0.74, times it by the white blood cell count, which is 7.8, and that comes out to 5.7, and that is over the parameter of 1.5.
Okay. All right. Very good. Okay. So as far as that, we're ready to go as far as the lab work. Now, the next thing we have to do is check the height and weight and the body surface area against the doses. Whenever the patient comes in, Lydia gets a height on the patient and gets a weight. If there's any difference of 10%, we have to notify the physician. But this is exactly what Lydia got. We would always check the allergy sheet to see what her height and weight was. Okay, so you want to do the calculation for the BSA.
Okay, so that is height in centimeters, which for him is 165, times the weight in kilograms, for him is 70, and then you would divide that by 3,600, and the square root of that number is 1.79.
Okay, and that calculation is called the Moss dollar calculation. Okay, so 1.79 is what the physician has written here. So now the next thing you have to do is check your doses. So you take your cyclophosphamide times the dose, 750 milligrams per meter square, and that should give you the dose to administer. So you want to do that?
750 times 1.79, and that equals 1,342, which the doctor has rounded down to 1,340. The doxorubicin is 50 milligrams per meter squared, and that is 89.5, which he's rounded up to 90. Vincristine is 1.4 milligrams per meter squared, and that is 2.5, but the maximum dose for vincristine is 2 milligrams.
And he orders the prednisone for 5 days. And they also want you to look up the MIGA scan results prior to starting chemo. And we're looking for the ejection fraction of greater than 45%, and his is 65%. Okay, so now you can sign those and send them to pharmacy. And then what will happen is pharmacy will send this back with the chemo with their signature on there. So that'll take care of all the checks. The doctor, the nurse practitioner, the nurse, and then the pharmacist.
Right.
Anna, your texting came out.
Oh, great. Good. Oh, they sent the pink sheet.
Yeah,
Good.
they sent the pink sheet.
Good. We'll double check signatures in a minute. Do you have a minute to check this with me?
Sure.
Okay, sure. All right. So let's go ahead. I just want to pull open the original order. Let's double check it, and then we'll go back through the chart and check our labs and everything else with that.
All right, sounds good.
So go ahead. You read off the bag, and I'll double check on the order sheet.
All right, Joanna Smith, 1500-898-327, date of birth 10/10/62. This is Rituxan, 648 milligrams and 648 mLs of normal saline, and it expires tomorrow at noon. Infused per orders.
Infused orders. Okay, so we'll titrate that up according to the orders on here. Okay, so I want to go back and figure and just double check the BSA with you, if you wouldn't mind doing that with me. So our height was 65 inches. Our weight was 145 pounds. And we divide that by 3131. And we take the square root of that, which would give us 1.73.
Okay.
And
that was her weight today, right?
That was her weight today, yes.
Okay.
This is her first dose, and she was just admitted this morning. So that was her current weight and her current height. We got a height on her when she came in. So,
okay.
So let's see. We're going to round that off to 1.73 times 375 milligrams, which should give us 648.75. So
Okay.
648.
All right,
Good.
sounds good.
Let me just double check our lab work with you.
Okay.
If you don't mind doubling
No,
that?
not at all.
Okay, so let's see, we have a ANC of, it looks like about 3,000, and a platelet count of about 150, so we're okay on platelets and that.
Okay.
The weight should be within 10%, and that's okay because this was her first dose, so we won't have that to go by, and the physician doesn't look like he rounded to the 5%.
Okay.
And, okay, so we have a physician signature when the order went downstairs, an RN signature signed off on it going down, 2 chemo nurses did. Pharmacist signatures on there. If you wouldn't mind just double checking behind me here as the second staff nurse on the way back, and I'll get someone else to check it for me at the bedside when I'm ready to hang it.
Okay.
Okay, thanks for your time. Have a good one.
Okay.
Hi Tish, are you available to check my chemo here?
Sure, Eileen.
Thank you.
Okay. You want me to read?
That would be great.
Okay. Jason M. Jones, medical record is 150-089-82672. Date of birth is 9/30/1950. The drug is doxorubicin. We're going to give a total of 90 milligrams. There's 45 milligrams in each syringe in normal saline, and it expires on 9/9 at 7 a.m.
Okay.
The next drug is for Jason Jones, medical record 150-898-2672. Date of birth is 9/30/1950. Vincristine 2 milligrams in 50 mLs of normal saline to infuse over 10 minutes. It expires on 9/9 at 7 a.m. Third drug is cyclophosphamide, and it's for Jason M. Jones, medical record 15089826672. It's cyclophosphamide, 1,340 milligrams and 250 mLs of normal saline, and to infuse over 60 minutes. It expires at 7 a.m. on 9/9.
Thank you.
Do you have a consent?
Yes, we do.
It's signed by the patient.
The consent is signed by the patient, the nurse, and the doctor.
Okay.
And here are the drugs: Cytoxin, Vincristine, Adriamycin. And the
Okay.
patient will also take prednisone, 100 milligrams by mouth for 5 days.
Okay. Do you want to read his armband, and I'll
That'd be
check the
great.
bags with his ID?
Okay?
Yeah.
Jason M. Jones, 15008982672. Date of birth is 9/30/50.
That's me.
Jason M. Jones, 15008982672. Birth date is 9/30/50.
That's your birth date, right?
That's my birthday.
Thank you.
Jason M. Jones, 15008982672. Birth date is 9/30/50.
Okay.
All right,
All right.
thank you very much.
If you need anything, call me.
Okay.
Thank you, Tish.
You're welcome.
Now, Mr. Jones, I'm going to be giving you your chemotherapy, and as we do it, I will explain to you what I'm doing. I'm going to put this little pad underneath your arm. And we're going to get ready to give your Adriamycin first.
Oh, that's the red one.
Yes. Now, your urine will be red the first couple times you go to the bathroom. First thing I'm going to do is check for a blood return. And there you have it, a nice blood return. If you have any questions as we go along, please feel comfortable to ask, so we can talk about it later.
Okay.
Like I told you, the first one is your Adriamycin, and it is red, and your urine will be red the first couple times, probably just today when you go to the bathroom. Nothing to be alarmed about.
Well, I'm glad you told me, because I would have been a little worried.
This does take a little bit of time to give. Since you have a peripheral site, that means when I begin your arm, I have to be very careful as to how fast I push it.
Yeah, I'd rather be safe than sorry.
If you have any problems while I'm giving it to you, just let me know as far as your arm bothering you, any burning, pain, itching, anything unusual, please let me know.
I certainly will. Wow, so that saline has to keep dripping while you're doing that, huh?
That's correct. That just shows me that it's a free-flowing IV, that your Adriamycin is going through, and that I'm not meeting any resistance or pressure.
Oh, I see.
so often I will need to be getting up to check in to see your blood return. Any problems with your arm or anything? Do you feel anything?
Well, it seems to feel fine. A little cold, but not unusual.
Okay, cold is okay. Okay, I'm going to check for your blood return right now again.
How often do you have to check that?
Approximately every 3 to 5 cc's since you have a peripheral IV. And there we go, you have a nice blood return. It's hard to sometimes distinguish between the blood and the red from the adriamycin. If you have any questions, please feel free to ask at any time, or you can ask later with your doctors, your nurses. Sometimes it's a good idea just to write down your questions, and I'll give you a notepad later.
Eileen, the doctor said something about putting a port in my chest. Would I be able to get this medicine through that too?
Absolutely. A port is just placed in your chest by a surgeon, and usually we can use it immediately. And it's just another way, and usually it's a little bit safer to give your medicines through there than to give it peripherally, because it's usually in a nice bigger vein than the veins you have in your arms.
Do you still have to do that blood return thing when you have a line like that?
Absolutely. We always have to check for a blood return to make sure that your port catheter was never dislodged or anything during the administration.
I may talk to him about getting that port put in then.
Yes, it is sometimes a nice thing because you can also get your blood work and other IV medicines through there.
Well, it gives me something to think about.
If you have any questions, please feel free to ask. Okay, Mr. Jones, I'm just finishing your second syringe of your adriamycin, so I'm going to disconnect that and dispose
that
of
was
it.
faster than I thought.
Yes, I think sometimes it seems a little faster than others.
Why did you wrap that gauze pad around there?
Well, I didn't want to have any leakage or anything between you, me, and the chemotherapy, this red adriamycin, so now I'm going to dispose of it in the proper receptacle.
Oh, I see.
Okay, how does your arm feel? Okay, it looks great. And
It feels good.
good. I'm going to check the blood return one more time. Great, you have a nice blood return. That tells me it's still in your vein. And
Oh, good, I'm glad.
And you're not having any problems at your IV site, as you have told me.
Nope, feels good.
So now I'm going to continue with your other drugs. As we spoke with Tish before, your next drug is going to be your vincristine.
And that's the one that can make you constipated, huh?
Absolutely. You want to make sure that you move your bowels at least every 3 days. And if you're having problems, you need to get in touch with the doctor immediately. Sometimes diet can also help. Make sure you're drinking enough fluids.
Well, I usually don't have any problems in that area, so hopefully it'll all keep working out just fine.
Well, that will be great. But don't hesitate to call. You can get in touch with anybody 24/7, even if you leave the hospital.
Yes, I have their number already.
That's great. I'm just going to connect this down to the lowest site, Y port, to your IV. Now, if you have any problems with this medication also, you need to let me know. Any pain, itching, burning, anything unusual.
Okay, I will pay attention if I have any of those. I'll let you know.
And I will stay here and monitor you while you're getting this medicine. It'll take approximately 10 minutes.
Wow, that's a long time
I
for that
think-
little bag.
Well, we have to be careful that your IV is not having any problems or you're not having any kind of symptoms or anything, so please don't hesitate to let me know.
Okay.
And then I'm going to also get a flush bag to flush that through. As soon as your bag is complete, I'm going to hook up a little flush bag to make sure that you have got all the medication prescribed by your doctor. Is everything feeling fine at your IV site? It looks great.
Everything feels fine.
Okay, Mr. Jones, I need to stop your infusion here for a minute. Every so often, we need to check for a blood return. So I'm going to drop your bag. Now I'm just checking for a blood return. There we go. That's great. Now I can continue on with your infusion.
Wow, there sure is a lot of blood return checking going on.
Yes, like I said, we just want to make sure everything stays in your vein and doesn't leak under your tissue or anything.
Oh, that makes sense.
Okay, we're just about done here. Now we're going to get my little flush bag ready with some compatible solution that is okay to be given with this medication. Our 10 minutes is almost up for Irv and Kristen.
Great. Then we'll move on to the last one.
You're correct,
I remember them saying I was going to get 3.
right? So this was almost, number 2 is just about completed. I'm just waiting for the medication to come down the tubing so I can flush it properly.
Yeah, I
Okay.
just want to make sure I get it all, huh?
Yes, it's very important that you get all your medication prescribed. So I'm going to hook up my flush bag here. Okay. And here we go with flushing your medicine out. And your arm feels okay, Mr. Jones?
Yeah, it still feels good. No problems at all.
Great. This will just take a few minutes. I do not have to run the whole bag of this little flush bag up here, so don't be alarmed if we throw some of that away.
Oh, okay, I'm glad you told me that.
Okay, that's approximately 20 cc's, so we're completed. I'm going to start disconnecting a couple things here, so bear with me.
All right.
I'm going to make sure all my clamps are closed. I'm going to get my little gauze pad. I have to dispose of this medication next.
Boy, everything goes in that yellow bin, huh?
Yes, so they can dispose of it properly and not with regular waste. Okay, your arm looks good, and how does it feel? Any
Oh, it feels
problems?
fine.
That's great. I'm going to check for another blood return. Perfect. Okay, Mr. Jones, the next medication I will be giving you is your Cytoxin. And that will take approximately 1 hour.
Oh, that's right, this is a bag, huh?
Right. So you can call us at any time. I have your call line available once I leave to make sure that you're not having any problems. And I will stick around for a few minutes at the beginning. This one will run on this machine.
I was wondering what that machine was doing there.
It's a little noisy at first, just to set it up. I'm just going to swab this off with a little alcohol here. And I'm going to slow down our main IV that is compatible with your Cytoxin.
Kathleen, do you need me to check the rate on your infuser?
That would be great.
You're giving the Cytoxin over 60 minutes.
Correct.
So there's 500
And
mLs. Volume is
is
500.
And then I'm just going to push start. And make sure everything is open.
It's to infuse over 1 hour.
1 hour.
Okay. Anything else?
Thank you very much. Okay, Mr. Jones. This is your Cytoxin, and I would like you to drink a lot of fluids, especially the day before, the day of, and the day after, because this Cytoxin doesn't want to be sitting in your bladder so that you can have problems. If you experience any burning in your bladder when you go to the bathroom, or any darkened or red urine, you need to let your nurse know immediately, or call your doctor if you are discharged from the hospital by then. Thank you very much, Mr. Jones. Please feel free to call me if you have any problems or have any questions. I'm just going to take off my gloves and gowns, and I will be back to check on you in a little bit. Thank you.
Thanks, Eileen, for doing everything for me. I really appreciate it.
You're welcome.
Thanks for answering all my questions, too.
You're welcome.
I'll be sure to call you if my IV starts to bother me.
Okay, I have your call light right here, and I'm also going to leave this little pad right underneath, just in case.
Well, I'm not moving from this bed.
Thank you very much. Hi, Mr. Jones. I'm back again. I see your medication has been completed, your Cytoxin. I will stop the beeping.
Oh, thank you. It just started, though.
Great. Perfect timing. Just going to make sure all your medication gets in. Very good. And I would like to check for a blood return again.
Yeah, here you go with that blood return check thing again.
It's very important, and that you have a great blood return.
Oh, good. So we can keep using my IV, huh?
For today, we will check it every so many hours just to make sure it's still a good IV. Okay, I'm going to get my little flush bag again. As you remember, we did for your other medication that hung in the bag. And this is compatible with this medicine also. And I'm just going to swab this with a little bit of alcohol right here. I'm just going to flush this through. There we go. This will just take a few minutes.
Wow, and then I think I've gotten everything, huh?
Yes, you will be complete with your medications today, except you need to take your prednisone, which I will give you shortly, and you'll get that for 5 days.
Oh. Is that going to help my muscles grow big?
We hope not too big. Okay, now that you are completed here, I'm going to shut everything off and disconnect. I'm going to leave your plain fluids running as your doctor has prescribed. Okay, Mr. Jones, I have completed your treatment for today with your 3 drugs of chemotherapy. Now I need to take everything down and dispose of it properly, and then I will be back with the new IV fluids for you.
Okay, sounds good.
Hi Tish, do you mind going over this documentation for chemotherapy with me so that I'm doing it correctly?
Correct. Okay. First of all, this will be stamped with the patient's name, medical record, will all be on there, the treatment and regimen. What you need to document here are your pre-meds, so you gave Zofran and Decadron, how you gave it, IV push, whatever route it was, the dose that you're given, and who mixed it. If it was mixed by a nurse, you put the nurse's initial, if it's mixed for yourself, or if it was mixed by the pharmacist, you would put RX. Down here, you would put the chemotherapy, so we gave 3 drugs. We gave adriamycin, vincristine, and Cytoxan. You would put the dose here. If it was mixed in a solution, and the route. If it was IV push, IV drip, sub-Q, however it's given. Who mixed it? If it was mixed by pharmacy, then there would be
Just an RX maybe there?
RX would be there, I think.
Okay.
The time up, that is the time that you hung the drug. Initials, there's a line in there, so you would sign it, and then your second person would sign it. So if it was me that checked this drug with you, then I would put my initials down there. Because they are high alert drugs, that's why there has to be 2 people checking them. So you need a time up and time down on outpatient because they use that for billing purposes.
Okay.
Okay? And then drug wasted, that would be for any nurse that's mixing, which we don't do in our department, but there are areas that do that, and how much of the drug was wasted.